She was the first Palestinian Australian surgeon to go to Gaza and has now been on 3 medical missions since 2024. Since returning, she has dedicated her time and effort into advocacy for the human rights and dignity of the Palestinian people. Since her return from the front lines, Dr. Bushra Othman's work has been about challenging the global gaslighting around this genocide, a force of intellect, care, and resistance. Dr. Bushra Othman, thank you for joining us on this episode of Two Pals in a Pod today.
Thank you so much for having me.
We like to start this episode, or each episode rather, by acknowledging that we are beneficiaries of settlement. We are living on stolen land, but we're also victim survivors of Western imperialism and racial capitalism. We want to ask, and start this episode by asking you, what is your origin story, your asl, your roots, and in the same breath, whose land do you live on? Do you fight on? Do you protest on?
I'll start by answering the second one. I am from Melbourne, or Naarm, but I am currently living and working in Sydney on Gadigal land. And for me, I think in particular over the last couple of years, I've definitely felt more of a deeper understanding about the connected struggles between us and the Indigenous people here on this land, because Palestinians know exactly what it feels like to have had colonialisation take over their people, to displace them, to not afford them basic human rights. And I think our struggles are interconnected in ways that a lot of us didn't truly understand before. What is my asl and my roots? So I am Palestinian. My dad is from a village near Jerusalem called Colonia, which is about 10 kilometres away. That was taken over by Israel in 1948. And my mum is from a village near Jenin called Silt al-Dahr, which a lot more people know than Colonia. They were forced to leave in the 60s in search of a place of safety. And so, like many migrant Palestinians, they went to Kuwait. That's where my brother and I were born. But war often finds you no matter where you are. So Iraq invaded Kuwait in the 1990s, and then we migrated to so-called Australia in 92. And that's what I've called home, probably up until the last couple of years.
You've been on 3 medical missions to Gaza, and you've just returned from the 3rd. What did it mean for you as a Palestinian, as a Muslim, as a woman, to make that decision to go the first time? It was quite early on in the genocide, wasn't it?
At that point, we'd watched maybe 40 days of the assault and genocide in Gaza on our screens. And those first days, the first few months, especially from what people have told me on the ground now, are nothing like what we imagined them to be. They were infinitely worse what we could see on our screens. Yeah. The fact that what they would describe to me, from my time in Gaza, is that you would just walk over bodies in the hospital. They were operating on people in the kitchens of the hospital. There was the bombing of Al Ahli Hospital, which 500 people were martyred. And in fact, the one surviving patient or person from that bombing was a patient that I ended up treating at Al-Aqsa Hospital when I was there in June and in December. At some point in those first few months, we started to see a lot more video footage of international medical doctors who were there in Gaza and reporting. And, one of the most prominent people was Professor Ghassan Abu Sitta, who was there in the early days.
And he's the one that actually coined the term wounded child, no surviving parent.
Yeah, and I mean, he's been there multiple times, especially before October, and so there was many other doctors and surgeons who'd done that. As a doctor, as a surgeon, it's maybe more so especially as a surgeon, especially with general surgery, there's so many emergencies that come about, and especially with trauma, you feel like you can sometimes make a difference. And so, again, this is what I've trained to do for the last 10, 12, however many years, or what I've studied to do. My role as a doctor and as a surgeon is to care for people in their potentially most difficult circumstances and be of support to colleagues in that type. and in that time and space. And so for me, it felt very, very personal that, like I had been put in this position for a certain reason.
You said that you were trained as a doctor, but you weren't trained to work in a hospital that a regime deliberately bombs. Like, you're going into a zone where the Israeli regime deliberately bombs hospitals.
Yeah.
So how did that play a role? The danger itself of having to go into a place that's being subjected to genocide, but were they deliberately targeting hospitals?
I qualified as a general surgeon in 2020, so I would be considered a junior surgeon, and I've not done a medical mission in, quote, a war-torn country. So partly I would say that maybe it's surgical training itself sort of instills in you this confidence and ability that you have certain skills to be able to deal with high-pressure environments, situations that are very emotionally charged, an ability to have to make decisions quickly, and sometimes to make tough decisions that other people can't make. Now, that's in a normal setting, such as what we would describe for here in Australia, like within trauma. And I will say that when I spoke to some of the Australians that had been before me, including a surgeon, they'd explained to me that nothing could honestly ever prepare you for what you go and see over there. I had a faith that if I wanted to go, if there was good for me to go and if it was written for me to be there, that I would accept whatever happened to me. So, people have often said to me, but didn't you feel scared, like when you would hear the bombs go off? Didn't you genuinely sort of fear for your life? And for the most part, I never did. I didn't think that I would ever not come back. So that's important to say. I certainly wouldn't voice any fear that I have to my parents. And I thought, I will never text my parents that I've woken up to the sounds of bombs in the neighborhood. It's just, there's no point worrying people from that perspective. But also just really that concept of yaqeen and acceptance of your fate, that if something happens, it happens. I can't control what Israel does, which is cross every single red line. They make up new, evil, sadistic ways of carrying out their plan to wipe out Palestinians in Gaza. But for me, really, it didn't make a difference.
I want to take a step back. You touched upon logistics, and I wanted to ask you if you could talk us through what it even took, to get into Gaza. Obviously we've seen and we've heard from you about being there. You've done extensive interviews. You've talked about it plenty, and that awareness raising has been so vital. But I think the administrative tyranny, the way that logistics are weaponized, starts from much earlier on. So I wanted to ask you, the delays, the blockade, what's allowed in, even from your perspective as a healthcare worker, what was that process like?
Yeah.
The first mission?
This is in general, even from, so before May. So, this is me now, February, March, starting to prepare for a mission that was going to enter through Egypt, through the Rafah border crossing, and thinking about, wow, we have such ability to take all of these things in with us. And at that time, it was you can only bring in truckloads of things, or you could only bring in 240 suitcases of something. Initially, even before Israel took over the Rafah border crossing, every few weeks we would get updates through the organisation that actually Israel's only allowing teams to be not 10, now they have to be 7. Okay, WHO has been limited in who's going. No, actually not 7, now only 5 people are allowed to go in. So
that uncertainty, that chaos is part of it. It's a deliberate strategy.
100% deliberate. What Israel does is there's nothing written. There's no formal communication. Even till now, in the last 3 to 4 months, or even since the start of this year, up to 50% of people who are applying on medical mission teams will get rejected for no clear reason. And when do they do it? They do it the night before or even on the morning that you're meant to be meeting your convoy in Amman. So what will happen is people from all around the world are travelling in, paying for airfares, preparing themselves physically, mentally, emotionally, psychologically, packing their bags. And a few hours before you're meant to go, your name will be highlighted in red and it'll just say rejected. And it'll come through as a WhatsApp text message even. There's no way for you to be able to challenge that. There's no rhyme or reason as to who's getting rejected. It's
Psychological terror, sadism.
It's very difficult to understand the depths of how far they've thought about trying to prevent us from helping our kin.
Yeah.
It's incredible.
It's a deliberate strategy of fragmentation in every sense of the word. And also, there is death, quick genocide. It's horrible to conceptualize, but there's also slow genocide, slow strangulation. And we'll talk about this a little bit more in depth, but, having the healers, having all of this to defeat you, to impact morale, all of that, again, is part of a deliberate strategy.
Yeah.
And to isolate.
People might remember that Dr. Abdullah, a general surgeon from Jordan, when I was there on my second medical mission in December, he was planning on entering with Panzerma, and he got taken in by Israel from that border crossing and was detained for 19 days or maybe 22 days or something. Didn't have access to a lawyer for the first 12 days. Definitely had psychological and mental torture. Can't comment whether he was physically tortured, but hearing him recount some of his experiences, I still to this day cannot process. I mean, it's almost sadistic to think that I can understand to some degree how Israel has abducted and tortured, Palestinian healthcare workers across the West Bank and Gaza. But there's this notion that as an international, you have some sort of safety net that might protect you. Jordan seemed to be a neighbour, and I don't know if you'd call them, they are an ally to Israel. You don't have to call them that. They call themselves that. And so to really try to understand that at any moment, anyone, any doctor, any healthcare worker who's there to fulfill basic moral duties and an ethical obligation to help has been abducted by the Israeli military and detained without access to his family or friends being able to check in on him for that first 12 days.
The impunity
that's
is
what
bad,
I keep saying.
limitless, boundless. Yeah.
There's been no accountability, so that's not going to protect you.
Yeah. And so, on that first mission, trying to pack, there was at least this concept of, okay, well, there's 2 suitcases we can take. You speak to people who've been in, the best information you can get is you speak to people who've been in before you. And so there was a couple of doctors that we knew that were on the ground at Nasser Hospital and at the European. So there were certain antibiotics that were not available that were really commonly needed. So we bought some of them in Amman. There was other products such as glucose monitors or blood pressure machines, stethoscopes, surgical supplies, just as crepe bandages, just very simple things that, how much could you bring? How much could you really help by packing 2 suitcases? But at least you felt like it was something at that time.
And for treating how many? Thousands and thousands and thousands.
This concept of Israel has planned and thought down to a T all of the different ways in which they can subjugate us, in which they can prevent us from helping each other, in which they can just slowly but surely, not just honestly kill us and exterminate us, but how to really break our spirits in every possible way. And that's one of the biggest lessons, for me, that confrontation of seeing it all play out in real life.
Yeah.
Again, people will remember that certain articles from healthcare workers came out in maybe September or October or August or September last year about all of these children that were being sniped, so having direct headshots to the brain or to the chest. Why are the bullets pointing downwards? It indicates a level of that this was on purpose. And then 7 to 8 international NGOs were banned from sending in medical mission teams for a period of time. Again, healthcare is a human right. There is no reason to block international medical teams from going into Gaza. And the contrast is seeing the complete silence amongst medical institutions and colleges that are meant to be upholding all of these basic principles and not having that, like this complete discrepancy between what should be right and what should happen, and people not willing to actually commit to saying it out loud or standing by that. Palestinians in Gaza are so honourable, have so much dignity that, like they never really want to ask for anything. And this this was even more confronting in the last few months, because to see them get to a point, especially the men, to have to say even things like, I don't want to burden you with this, but could you bring some medication for my dad? Like, he hasn't found any of his blood pressure or blood thinning medication for months. Or, one of my colleagues, his sister was in an accident in Gaza many years ago, and she has seizures, and so she just hasn't had any of her seizure medication. We got to the point now in the last few months where people are like, coffee, if you could just bring us some good quality coffee, like that would be so amazing. Like, for them to admit that, like this is the state that they've been forced into. And so again, it's this feeling of helplessness. Like, I have one suitcase.
You mentioned about like men asking for like how much that hurt their dignity. So we wanted to get a bit about like the gendered aspect of what you witnessed in particular. Like, among your patients, what did you notice specifically about the way that women, children and men were impacted differently by the genocide?
One of the biggest things is that, people who've been starved, who are so desperate to go to these so-called aid sites, which in fact is it's a slaughterhouse. That's basically what it is. I mean, the majority of people going there are men. So people in their 20s or 30s or even 40s. Some of them are taking their young boys with them. So there was lots of teenage boys, even boys as to 9 or 10 years old. But that doesn't preclude some women from going. So I remember we had a 42-year-old mother come to Al-Quds hospital. She was transferred from Al-Shifa, who, the ambulance officers who brought her in had said that, whoever had found her and had recognised her had said that, her youngest daughter was crying so much throughout the whole day, just saying, "Mum, I'm starving," that she felt compelled to have to go to these aid sites. Now, I don't know whether she had a husband or a partner, so she's gone out. She's coming and having been shot in the abdomen and groin. Her big blood vessels from the abdomen going to the groin were completely shattered. She probably had over 3 litres of blood abdomen. She's presented late. All of these factors are impossible to try to treat appropriately in Gaza. So here we are trying to save a 42-year-old mother from life-threatening bleeding that in any other part of the world would be difficult enough. She didn't pass away on the operating table, but we basically closed her up, took her to the intensive care, and then within 5 to 10 minutes she had been martyred. She passed away. And so I think, even this concept of mothers who are trying desperately even just to find a morsel of food to feed their children are going to these so-called aid sites.
So they're either trying to look for food or they're being bombed.
So you're either being shot at deliberately,
looking for food.
Looking for food and trying to get aid, or there'll be army tanks there that also fire out. So they might be firing, and then people will come in with shrapnel injuries injuries from bits of flying metal from all around. So I think men in particular are always the providers, and so they're going out to these sites to provide aid. They're going off to try and look for food elsewhere. The other really common pattern was that, which places would get bombed. I mean, it's where just regular Palestinians would be staying. So, what's even more sadistic. So when I was there was the bombing of the Baqa Cafe, which is near Shifa Hospital out on the beach. Who's at that cafe? I mean, lots of young journalists. Yep. So just yesterday or today, I saw on Instagram a video about a boxer, a young female boxer. So she was at the cafe with her friends.
Yes.
Her friend has called her father to say, she was at that cafe and she'd been taken as a patient at Shifa. And so I remember that day felt a little bit like, I don't know what the day of judgment will feel like, but the majority of patients that came in that were thrown about on the floor because there was no other room for them were young females and women. Arms and legs are missing. people lying in a pool of their own blood. People are, these women are taking their last breaths. Within moments, you would see the patient's been martyred in front of you. They would say a prayer over them. They'd wrap them in the white cloths, and then they would take them out of the emergency department.
And not enough doctors, obviously.
It's very, very difficult to describe like the levels of chaos. In Arabic we say fawda, like the levels of chaos of something like this. So I was a shifa for the majority of my time during this third medical mission. This is all them. This is not how it used to be. So they're in a building that's been refurbished, revamped to try to be able to provide medical care now. And so they've built these two small operating theatre rooms that are right next to where the emergency department is. There's this tiniest little hallway for patients to go in and out of these operating theatres. It's exceptionally cramped. You can not even turn a normal bed into that hallway. And so you'll be operating, and it was constant. The work is constant, so you'll be operating, and you just hear screams. You're hearing screams from patients. You're hearing screams from family members. You're hearing the hustle of people running around trying to provide care. You go out into the emergency department, people everywhere. It's exceptionally hot and sweaty. There's gates, there's the main gate and almost like the back door area where people can go in and out of the emergency department. They have to be closed to prevent more people from coming in and just us having extra bodies around. You don't really know who are the doctors, who are the nurses, like who's providing care, who's more sick than anyone else, because everyone's everywhere. There's no real
triage.
There's no ability to be able to sort of deal with things really in an organised or ordered manner. And that's through no fault of their own. Like this is just, sometimes you're getting 60, 70, 80, 100 patients even at these times. And so that would overwhelm any emergency department in any high-level facility anywhere around the world. And so, they've bombed Al-Baq Cafe, they've bombed the Rimal neighbourhood in particular, cafes or shops. They bomb universities where people are taking shelter.
UN schools,
you name it. Just the other day I'd heard about how a family was having Gaza, so they were mourning the loss of one of the kids from their neighbourhood, and that gathering was struck with a missile.
Yeah, we are not afforded the dignity of mourning.
Nothing.
Like with the pager attacks in Lebanon where they were at the funeral and then they were bombed.
Right.
Yeah.
Then the pager attack went off again, sorry.
Yeah. So, women sort of in these like very commonplace sort of environments are not spared either. Again, like some people will say, oh, well, why would anyone even go to a cafe like in Gaza? Like as if you're not allowed to live because of what's happening, and everyone is different in terms of how they deal with things. But the bottom line is life goes on. These people had lives prior to all of this happening. They have hopes, they have ambitions. They need to be able to pass time and feel like that they have the ability to go out with their friends and meet and chat and have a coffee, all things that we would consider normal things to do.
And not just sit there as sitting ducks, waiting to be
waiting
killed.
for their death.
Yeah.
Exactly.
Yeah.
It's just an extraordinary sense of resistance and resilience.
Yeah. And the final group, children, just to talk about things is, I personally have treated now a few kids that have been shot by drones or by quadcopters. I'd mentioned at some point during my Instagram stories about a young 13-year-old girl, Rama, who's actually a relative of a doctor here in Australia. So she has a twin brother. They're both 13. Their parents have waited for over 20 years to be able to conceive them. They have been displaced multiple times and live in a tent. The mother described to me the story. The young girl helps her mother so much. And so she had put the washing out on the line. She came back to lie down in the tent for a little bit and then wanted to go check to see if the clothes had dried. She was standing at the entrance of the tent and she was shot through the chest and into the abdomen by a quadcopter. Now, what possible reason, justification could anyone in the world come up with about why this young girl could be shot by this quadcopter? In my last couple of days at Al-Aqsa Hospital before the mission ended, there was a young man brought in who was the nephew of one of the urologists, so one of the surgeons there. He'd gotten married a night before. Again, he went out on the morning or at lunchtime to step outside his abode, and a quadcopter shot him. Again, torn through his chest, torn through his abdomen, riddled him with injuries. And so there was a number of us that ended up operating on him. And again, there are endless stories and documentations of X-rays and CTs and operative procedures on all of these Palestinians, young or old, who've all been targeted for no reason other than the fact that they're Palestinian, and Israel has the ability to do so without being checked.
And it's just astounding to hear the fact that it's as big as a spectacle, like a bombing of a cafe, a beachside cafe, all the way down to the daily, the moments of joy, a wedding, interrupted, stolen, and even moments that are so mundane, like hanging up your laundry.
Yeah.
Nothing, nowhere is safe.
No
moment is safe or sacred,
No.
no matter how big or small.
When you're there as a healthcare worker, especially as an international, they tell you, yes, there is no safe place, but there were all these moments in time where we could have been there and something could have happened. When I had taken a patient to Al-Quds Hospital, and my colleagues had said, luckily you weren't here. There's a car that's been bombed outside the accommodation building of a Shifa. I rode in ambulances multiple times taking patients between these hospitals. There's no GPS on me. Israel doesn't know where I am. Ambulances are not afforded any protection, even though they are deemed under international humanitarian law to afforded safety and protection. And so I think all the time, there's all these moments where things could have happened, and it's really just by the grace of God and probably through the dua and prayers of others that you're protected.
You've sort of catalogued all the egregious, heinous violence of quadcopters and being shot at, but there seems to be a shift amongst people who have remained silent and seem seemingly okay with that kind of mass slaughter over starvation. So can you talk us through what that has been like on the ground?
Yeah.
What does deliberate starvation as a strategy, not just a tragedy, look like?
Yeah. We are so lucky, so privileged to be able to be in a country where at any moment, you want a cup of coffee, you want to have something to eat, that you can order it through your phone or online. And if you have never fasted on purpose at any point in your life, if you've never been in a position where you didn't have food, you can't really understand how 4 months on a background, let alone of 2 years, of not having enough caloric intake, let alone to feed yourself or your family, impacts you physically, emotionally, psychologically, mentally. But more than just at an individual level and all of these different systems that get attacked, what I think became really obvious to me, what I noticed in my 5 weeks there on this latest medical mission is, they talk about how starvation is a tool of war, and it's a long practiced ability to be able to, you don't have to kill people, but if you just, you can eventually kill them by starving them, but it's just a very demonic way of taking away their agency and their ability to have food. So the first thing I'll say is that one of the ways that was described to me about, why is Israel doing this? Well, it really fractures at the heart of the community.
Yeah.
So, lots of people will understand how food is a common ground to bring people together. If you've had the pleasure and the honour of knowing a Palestinian, you will know that we show our love through food. That is very evident when you go on a medical mission. I mean, people often said, what did you do for food? I mean, it's embarrassing, and I'm ashamed to almost say that they looked after me so well and made sure that I would never go hungry. And people would almost be taking food out of their own mouths in order to feed me. I mean, just that alone should make me cry for days straight. But, what they explained is in the beginning, those first couple of weeks, Israel didn't even have to bomb anything anymore. So they've just made it so impossible for people to be able to find food to live that now they're starting to turn on each other. Yeah. And so, like you put something like this disgusting excuse of a food distribution point as a means for them to have, a small sliver of hope or salvation that they'll be able to go and get some flour so that maybe for that 1 to 2 days they could feed their family. And you have to basically go there thinking, I'm putting myself above anyone else, and I will almost fight anyone to be able to get this. And so, one of the most beautiful things about Gaza is this concept of community. Like no matter where you go, people want to look after each other. It doesn't matter if it's your relative, if it's your neighbor, if it's your colleague, if it's just a random person. And so after 4 months, to get this community to be at a point where they could turn against each other to be able to try to survive is how Israel has tried to really fracture that spirit, that real Palestinian Ghazawi sort of spirit. But even if you think about, deliberate targeting of healthcare facilities and healthcare workers, well, even if you continuously bomb and send missile strikes and drones and quadcopters to maim people but not kill them, they need to go to a hospital to get treated. Who are they being treated by? By completely burnt out, physically exhausted healthcare workers who are not able to even provide that level of care.
So then what all of this, the starvation, the bombing, what does this do to, the people, obviously, but also the medical processes when everything is collapsing all at once?
I've heard so many times from people in Gaza that work in healthcare, they would say, this isn't medicine. Like what we're doing here, this isn't what they used to do, certainly, before October 7th. I really hate to think that when we describe everything that's happened over the last 22 months, that people could have this image of Gaza as this country that, this place that didn't have really high standards of providing healthcare, like facilities that weren't top of the line. Like Al-Shifa was a monumental place across all of the occupied Palestinian territories for care. This is almost like a world-class facility. And they took such pride in that, they would have internationals come in and train them up or upskill them. They take pride in their ability that as healthcare professionals, there's honour and dignity and purpose in providing that level of care for your community. But this time feels exceptionally different. There's this new technique of starving people, this enforced starvation, has really incapacitated healthcare, more so than even just that the healthcare facilities have been targeted. Because at least if you had the personnel to be able to provide some level of treatment, even though it should be nowhere near the level of standard that you would want for them, who's going to be left to treat anyone that's being maimed by what Israel is doing?
And how does a starving patient rebuild and heal? It's
exceptionally difficult. So I remember I quoted when I was there in June of 2024 that at that time wound infection rates were maybe 90%. Patients who were going into intensive care had very little chance of survival and actually making it out alive. This time, you've got complete inability physically to be able to deal with very simple things. So, people coming in with wound infections were passing away because even if you could give them some antibiotics, nutritionally their bodies had no reserve whatsoever to be able to combat any infection. More than that, it's like the degree of how many attacks were happening every day. So you would be in the operating theatre working 24 hours. And, a lot of the times when you might hear internationals, in particular us as surgeons, speak about, all of the surgeries that we're doing, and we're talking about trauma surgeries, there are lots of emergencies that need to happen for non-trauma related patients. So I still operated on patients with bowel cancer that had bowel blockages. People still got appendicitis, people still had hernias, people still had lots of other medical issues that needed to be treated.
And are very treatable, generally.
Should be very
Yes.
treatable.
Yes.
Like, I mean, you know, what feels like smuggling in blood pressure medications and medication for diabetes for 1 or 2 people. I managed to bring in baby formula. I managed to bring in some multivitamins for some pregnant women. And again, that felt like I've helped 1 or 2 people amongst many millions. But, you know, this concept of their attacks are so incessant and continuous that you're operating, there's not enough operating theatre space. So you'll hear them telling you outside patients are dying and we need to try to get them into the operating theatres, and they will die. Multiple patients have died waiting to be able to be operated on. And, to some degree, maybe they never would have made it if, you know, they had such life-threatening injuries. But as a doctor, as a surgeon, for you to feel like you're operating on someone. So, you know, I remember, you know, people might know necrotizing fasciitis, the flesh-eating bacteria. There was a young female, Wafat, who got sent to me actually because she wanted to have a female treat her. So here I am operating on something that's not directly related to war. Now, maybe because of really poor conditions of living, poor nutrition for many, many months, poor ability to have sterile conditions. You know, this lady's developed this really severe infection, which is life-threatening. And so here I am cutting away all of this dead tissue, and people are telling me, you know, there's a patient dying outside. We really need this operating theatre room. Like, you know, what are these difficult decisions that you sometimes have to make? Well, who has the priority? The patient who's already asleep on the operating theatre that I know I can save if I can cut out all this dead tissue, or the patient who might be bleeding to death outside, whose family member might have run through security to try to get into your operating room to tell you, please save my daughter or please save my son.
It's an impossible choice.
It's an impossible
choice.
It's an impossible choice. So, you know, it's just this concept of they've taken away all this ability for you to be able to make these decisions to provide what should be very easy care for some of these patients.
You know, we're asking you like to relive some of like impossibly traumatic experiences, but it's because it's so it's so incomprehensibly evil that it needs to be testified to.
Yeah.
Because they cannot get away with this. They cannot deny it. You know, this kind of testimony has to be on the record.
Yeah.
At this level of detail, because as you've laid out for us, it is so deliberate and strategic at every level, and it's cheaper for them to starve people as well. I was thinking, you know, it's like they've thought of everything.
Yeah,
and that's a pretty important point that you're making, Rhonda, because, you know, Bushra, you were there as a doctor, but you are also, you know, you're taking up this role as your witness and a vessel, in a way, a conduit. And I wanted to ask you, you know, what do you see your responsibilities as in those roles? What are the ethics, and where do you draw the line between, do you draw the line? How do you draw the line between being a doctor and being a witness in this context?
sometimes I would do things that I wouldn't necessarily do here. So, for example, there was twin boys. One of them was martyred in the emergency department. The other one had such severe fractures of his left leg that we needed to do an amputation, which is not something that metropolitan general surgeons would do here really, but that in a trauma or a rural setting you might be expected to do, and I'd had some training in that. So that's really sort of like from that physical role. But I think for me, learning about, you know, what does it really mean to bear witness when you're there? There is no separation between all of these different roles. I mean, we are all heterogeneous, multifaceted beings in our everyday lives. So everyone holds many different positions. Now, I'm a daughter, I'm a sister, I'm a general surgeon, I'm a colorectal trainee, I'm a friend. Like, you know, I hold multiple different positions. And that doesn't change just because I'm a surgeon that's gone to Gaza. But really, now it comes down to when you witness evil playing out before your eyes against your friends, your colleagues, your people, and then you come back and you have to not only reckon with that, but try to think of a way as to how can you really help change things on the ground. And so part of that, one, is testifying to the crimes that you've seen committed against the Palestinians in Gaza. So now that's either giving evidence either for the International Criminal Court or for the ICJ, or writing it down or sharing it with the public, whichever way in which you need to document what you've witnessed from that perspective. There's this concept of, okay, well, you bore witness, and so then it should fuel advocacy and action, not just for yourself, but for others. And so your role then is also to be an educator, to be able to spread the message. Now, maybe most importantly for me, within healthcare. So here I am, part of a profession that's supposedly meant to uphold that we would care for and protect the most vulnerable of communities, the people who are oppressed, who've had injustice thrust upon them, who really have no voice of their own. And, you know, we don't deal with that often in Australia, definitely not to the degree that I would deal with it in Gaza every single day. And so then it's incumbent for you to take upon that role to say, all right, well, I need to be able to go to conferences, I need to be able to speak to my colleagues, I need to be able to write in journals about my experience and what I witnessed in order to disseminate sort of this information.
Bushra, many Palestinians have written about how language keeps us auditioning for humanity, sympathy, grievability. I also have been thinking about the way language obfuscates and is, used to co-opt and distort and betray. One of the words that has been irking me is neutrality, and the concept specifically relevant to you and your field is this phrase, this medical neutrality phrase that we keep hearing over and over. And how do we think about that? How do we talk about medical neutrality at a time when one side is quite literally being entirely annihilated?
I think it's very simple. People don't want to have to think about something that's emotionally difficult, they don't want to have to consider what it means to confront their own biases within medicine. This term of medical neutrality is just being weaponized as a way to provide silence and cover for people to basically say that they need to stay out of this political situation that's occurring over there. We keep forgetting that within healthcare, we have a moral and an ethical duty to stand by and do what's right when we're faced with witnessing war crimes or witnessing genocide unfold. We've all taken it as part of the medical oath when we've become doctors. I think that's all fallen to the wayside, basically.
What's a reasonable ask? I mean, what can we expect healthcare workers to do, say, in the context of this colony right here? How can healthcare workers step up? How can they support? What is a reasonable thing to ask of them? What would be okay?
Yeah. Normally, I'm such an optimistic person, and after this third medical mission, it feels like my faith in our profession has really just plummeted. Just the other day, I had people at work say to me, "Oh, you were on a medical mission. Like, we didn't know that's where you'd gone." And so I said, "Yeah, I was in Gaza." And they said, "Oh, look, I don't know much about the situation, but isn't this all just a response to what happened on October 7th?" So, wow. I mean, what can I expect from people in my profession? First things to say is that we are meant to be intelligent, empathetic, compassionate people who look after vulnerable communities. And so the first thing is to actually just try to engage in some level of education. We shouldn't have to, as Palestinians, as doctors and surgeons who've gone over there, have to raise our voices in order to be able to show and tell what Gazans or Palestinians in Gaza have themselves been showing and telling us for the last 22 months. But it really feels like these conversations need to just be continuously had on a day-to-day level. And so education would be...
If I can just say, it also comes at a price for those who are speaking out and being vocal and trying to educate, as you say, because they've also been met with punitive consequences.
Definitely. So, there's a very long list of people in the healthcare profession who've been doxxed, who've lost jobs, who've had their reputations tarnished in the medical and wider communities, who've been assaulted and bullied and harassed either online or in person at their GP clinics, at their offices, at their hospitals, all by a certain group of people who don't want the truth to come out about what's happening and want every single person who's raising their voice to amplify the Palestinian story of what's happening in Gaza to be completely eradicated and to think 100 times before they would even say anything about what's going on.
It's a real grotesque confession when they use like the language of neutrality.
Yep.
Because what they're confessing to is that you can be neutral over genocide, over war crimes, over starvation, which is, if you're neutral over that, people say it time and time again, then you're okay with it.
And even at the most basic level, you accept atrocities being committed against your own peers, professionals, colleagues, healthcare workers, ambulances. So even the most obvious, red lines, the safest, we'll call it the safest red lines that have been crossed, that is the bare minimum expectation.
So, the fact that I can relay stories of healthcare workers who've been abducted or imprisoned, who've had to run out of their homes within 10 minutes, who've been displaced multiple times, who live in tents, who don't have food and water. If I had heard that story about any other healthcare worker anywhere around the world, I would expect some level of compassion and empathy to say that, what could I do to potentially help that person? And so I think, even just some basic decency, some morality, because if you're willing to accept that for the Palestinians that are happening in Gaza, what does that really say about your value system of what you offer here within the healthcare field? Like, if you don't practice what you preach, or if you only practice it to select people or select communities, how are we really abiding by the values and the core principles of what it really means to be a healthcare worker or a doctor or a surgeon?
It really exposes the profoundly deep level of anti-Palestinian racism that exists in these institutions.
Yep.
And it also frustrates me that the call to action requires you to educate doctors about what starvation looks like, or bombs, or hospitals being bombed and destroyed when it's all being live streamed.
Yep.
Like, nobody can say they don't know and can't see what's happening. I think there's a profound level of desensitization to Palestinians as mutilated, as destroyed bodies, as starving bodies, as victims, and you've witnessed that. But beyond their trauma, their suffering, even though no one person can tell the full story of Gaza, can you talk to us about the patients you met beyond their trauma? Their quirks, their hopes, their fears, their dreams. We can't just think of them as victim survivors.
Yeah. And they're not. And I mean, there are so many beautiful stories and people. And, when I think of Gaza, I think of home. Now, for me, it feels like home. And, they say, why do you consider any place home? Well, it's either because of the place itself or because of its people. And they have taken me in and treated me in such a generous manner. I've been lucky to have treated patients across a wide spectrum. So I've got young kids that I've treated. One of them, his name is Yusuf. So Yusuf was injured at the start of maybe November 2023. He'd had an injury to his right hip, and so he can't walk properly anymore. His hip really is at right angles, and he ended up with a stoma bag, so a bag on his skin where he evacuates from. We tried to reverse that bag for him in December, and we weren't able to. Now, one of his things that he used to love was these instant coffee packets that are sort of like 3-in-1. So you've got coffee and...
I love those too.
Oh, the coffee mate.
Well, I mean, it's sugar and, this form of coffee mate, like milk powder and coffee. And so, I mean, not taking into account the fact that I think everyone who was involved in that operation was emotionally traumatized by the fact that we couldn't put his bowel back together. I remember afterwards, saying to him, thinking like, what would a 13-year-old boy like what could I, as a young female surgeon, like encourage this boy to be able to get up after this operation and not be depressed and stuff. And his father said to me, that he really loves like this instant coffee kind of packets. And so I said to him, okay, well, today's like day 4. If you get up and you go for a walk, like I'll bring you like this instant coffee packet. And lo and behold, I looked out of my window one time when I was getting changed and I saw him in the courtyard outside walking and sitting with his dad. And so I brought like these 2 little coffee cups of instant coffee. Now, flip the script. It came to the end of my second medical mission, and his dad called me and said, Yusuf really wants to come and say goodbye to you before you leave. They'd given me a packet of like 30 instant coffee packets that he'd like love for me to remember him by. This kid is so intelligent and smart. And now so I saw him again because they are displaced, but they're back in Gaza, like near Al-Shifa hospital. His mother's given birth to their newest sister or youngest daughter, so conceived and given birth in the last 9 months during these most difficult of circumstances. And he would come to the hospital for his physiotherapy appointments and come to check up on me, wanting to come and see me. I've had patients give me fruit or offer to buy me sweets and, again, say to me, thank you for just smiling at us and just spending time just like listening to our stories. I've met so many beautiful healthcare workers. I mean, the number of medical students, especially females, have come up to me and said, you've reinstilled like our hope and our faith that, we should continue with our studies, that surgery is sort of possible. I mean, this third time in particular, working at Al-Shifa, I worked with a lot of young female surgeons. So there was a young boy who was probably about 17 or 18. And when I talk about community in Gaza, families are really almost the backbone of providing care for patients in hospitals because they would be the ones feeding them, cleaning them, emptying any of their tubes or drain tubes that they've got attached to them, even giving them medication and whatnot. And in our accommodation building, there was a father who eventually started recognizing me as part of the surgical team who one time really said, please come and see my son, I think he's really sick. And so sometimes you would pay attention to the fact that actually these family members have been with these patients all the time. And I went to see him. He'd had an operation a while back and he had a drain tube in and the drain tube looked like it was draining stool. So I knew that something had gone wrong inside his abdomen. By the time we even got around to getting him into the operating theatre because there were so many other emergencies, he was exceptionally sick. Now, we're seeing one of the anaesthetic technicians really pulled strength and depth to try to keep this young patient alive in the operating theatre, like something that I will never, ever forget, I think, in the history of my time as a doctor. And what the family, so what the father, the mother, all of the sisters said to us, this is our only son in a family of 7, like we've got 6 daughters and this is our only son, he's, wahad, like the only one, like please do everything you can. It's this really almost like distressing position to be in, like, that you will try to do what you can. It's probably almost too late, like having operated on him. He managed to get a bed into the intensive care and the intensive care is on the ground floor. And so every time you'd go up to the second floor of your accommodation, you would see this family outside and, they'd always recognize me and say to me, please just go check on him. Like, is he okay? And I think the team has seen him like an hour before and I'd say, yep, that's no problem. I'll go and check in on him and say, look, he's stable or he's not good. And so you'd always see this family outside, like, please make dua for him. He's our only son. He's our only son. And you knew that one day when you came down those stairs and you didn't see that family, it was because their son had passed away. And so there would be all these stories constantly where even if you manage to get this patient to the operating theatre and do what you can, suddenly the next day or even a few hours later, you'd go back to check on them. I'd find someone doing CPR on them or I'd find out that they'd passed away and there was no rhyme or reason to it. And part of the reason this time we think is just starvation has taken a toll on people's bodies and it's just physically whatever they can deal with, they're at such low levels now that any little thing will just tip them over.
It's really hard to have moments of levity, I think, especially after a conversation like that. But I think it makes it all the more important for us as Palestinians and as people holding on for any semblance of joy so that we can keep going, sustain each other, because that is, again, our duty and our obligation. We can't stop. So it is difficult to have moments of levity right now, but that is why it is all the more important, all the more urgent for us, and to do it with intention and to do it in the spirit of holding each other. I wanted to ask you, what are some words that you have lived by? Is there a quote, a poem, a verse, a piece of writing that has been anchoring you in this time, especially now?
Look, it's difficult. Probably one of the first things that really comes to mind is this phrase that I know all of the Muslims say, but people in Gaza in particular. So, Hasbuna Allah wa ni'mal wakil. So, Allah is sufficient for us in these times of calamity. And the reason I say that is because, we went earlier and you asked me about, like patience and feel-good stories. I mean, the fact that every time you'll ask someone in Gaza, how are you doing? And they will reply with Alhamdulillah, praise or thanks be to Allah, to God.
What's something that you're no longer apologising for as a woman, as an Arab, as a feminist?
I think the third medical mission of the last 5 weeks really has taught me that you cannot leave any stone unturned to be able to trying to change things on the ground now. There is no debate over what's going on. There is no two sides. There is no trying to convince people of Palestinians being humans deserving of rights. You're either on this train with us wanting the same dignity and honour that you would want for yourself or any other human to be afforded to Palestinians there. These are my friends, these are my colleagues, these are people I consider family. I'm not apologising for what I would want for them. And so I think it's just become much more clear to me that relationships or interactions with people who do not view Palestinians in that same lens, I don't afford them my friendship or my time or effort or energy anymore.
Absolutely.
If you could send our listeners a feminist care package to get through these times, what would be in it?
I would send them friendships such as those with Randa Abdel Fattah, Sarah Saleh. My God, I would send them so many different people from Gaza. But if you want tangible things, I mean, I don't know, for me now coming back, I feel material things are just so, not useless, but that's not really where I think grounding really needs to happen. Yeah. I think I would send them compassion. I would send them a shoulder to cry on, because sometimes that's just honestly what you need. I would send them 2 to 3 really good, solid rock friendships to lean on, because it is difficult dealing with this day in or out. And probably some chocolate too. And some good coffee. My God, I can't believe I forgot that last
Not the 3-in-1.
Yeah, not chickpeas or hummus, but like real good quality coffee.
Yeah, thank you, Bushra. We often say we don't want to romanticize Palestinians and make them superhumans, but honestly, I feel like I meet a superhuman when I meet you and encounter you.
Definitely not. Oh my God, look at the company I'm in.
No, you remind us of what it means to fully embrace humanity, and your courage and your wisdom and your grace and your humour. So I'm not giving up on the idea that Palestinian women are superwomen just yet. Thank you so much.
Thank you guys for having me. Free Palestine. Yeah.